Is the doctor right? This is one simple question that I come across very often with women who undergo either hysterectomy or some form of a surgeries, whether it is for their knees or back. So here, what really happens is that when they come to me after decades of their surgery or decades of their treatment procedure itself, they have lost their flexibility in that particular part. Let me take a simple example. If a person, or if a lady is undergone a hysterectomy for whatever complications that she had to go through the surgery, now she struggles to bend forward or she carries a huge fat belly, and there is lot of weight gain in a person. Okay, so when I ask them what really may brought that kind of a shift in your body, then they say it is the doctor who told me not to do certain things, right? So when I dig deeper into this conversation, I hear that doctor told me not to lift weight for window period of maybe 4 to 6 weeks, any time range depending on the severity or a complication that person would have undergone. So now, the question comes, have I stick to the timeline of 3 to 4 weeks, right? Now what really happens is, out of my own fear of getting more complications or avoiding further hospitalization, I would be restraining myself from gradually coming out of that weight restriction and moving on to my normal routine, right? So here what really happens is, over the period of time, I forgot that I had to get back to my routine after a couple of weeks, but then I continued to live the same lifestyle out of my fear. So now it's easy to point out and say that doctor told me to take rest or doctor told me not to lift the weight. So now the key thing is, doctor is absolutely right about the weight restriction for a certain window period. But then what really happens is that I forgot to stick to the timeline and I went on with my weight restriction lifting. So now there's a huge price I'm paying for this missing point, right? So it's very, very important you specifically ask to your doctor, how long should I be not, lifting the weight or be on restriction, and how to switch back. Of course, after that window period of avoiding or on restriction, it will be slightly difficult than your normal way to get back to your routine. So what you really need to understand is, it is going to be not as it was before surgery. It sometimes it might ache and pain still. It is very, very important that you gradually get back to your life after your surgery. Otherwise, you end up losing your flexibility, or there might be more complications like weight gain or fixing of your particular region. Okay, so it's very, very important, be mindful of the timeline that is specifically mentioned to you. If doctors forget because they have a huge load, right? And I'm sure they would have mentioned it in your discharge summary, or they would have also vocalized it many times. We can also miss the timeline when we are going through so much anxiety post surgery recovery, and then going back home and medication, lot of things might play a role, right? So here it's very, very important, stick to the timeline so that you can get back to yourself as quickly as possible after your surgery also. So yes, doctor is right, but then key is to remember the timeline mentioned to us. Hope this helps you. Thank you so much.